Welcome back, everyone. I hope you had a great lunch. We had a couple of questions about the track that Cobus Grayling is hosting. Unfortunately, he's not here with us today. He's doing his part online. And you can check the online event through the Agorify app. But before we do that, or before you do that, we're here to listen to someone very special. If there's one field that can use the application of conversational AI, it must be the healthcare sector. Not only for appointment scheduling, but also for customer care and giving basic information. But that we want it doesn't automatically mean that we should or that we can have it. There's discussions to be had about the use cases, but also about the technical implications. There are a lot of challenges that we're facing, and here from Rush to talk about that to us today, please welcome Paulina Lewandowska.
Hello everyone, it's great to be here in person and that you have the interest in this use case in a healthcare space, and of course also being virtually present in other locations. Is it better? Sorry. So let me introduce myself. I'm Paulina Lewandowska and I am a conversational designer. I joined Human-Centered Design subchapter in Roche Informatics last October to continue my journey. Before that, I was really taking part in few experiments around implementation of conversational AI, mainly in patient-facing conversational interfaces. So maybe a little bit what Roche is, and today I was introducing myself to a few people, and I got answer that you produce cosmetics. No, we are not the company which produce cosmetics. We are a pharmaceutical and diagnostic group, really pioneering in advancing science to really improve people's life. As you can see, I will be closer. As you can see, we have quite a long history in bringing novel treatments and diagnostics to patients. And actually, patient is and will remain at core what we are doing on a daily basis at our work. We are also 10th globally and first in the healthcare space, investing in research and development. Last year, we invested 40.1 billion Swiss francs, in that area. And we are doing that because really we work toward the purpose that we are doing now what patient needs next. And because this is not a healthcare summit, I will also bring you some numbers, what the next mean. So actually we are aging as a population. So according to World Health Organization, there will be more than 20% of our population over 60 years by 2050. So it means that this number will double to what we have now. Furthermore, more population, around 80%, will be living in low and middle income countries, and we already know that the access to the healthcare services, primary healthcare services in the low and middle income countries is already a problem and challenge. But it's not only about low and middle income countries. So according to Eurostat, European Union database, in over half of the European countries, 20% of patients is really having problem accessing the healthcare services due to the long queues. And for some countries, it even goes up to 35% currently. Furthermore, WHO predicts the shortfall of 15 million healthcare workers globally by 2030, again, mainly in low and middle income countries, but we know after pandemic that this is significant actually for whole healthcare system. And I need to have my breath back. So last but not least, actually, the non-communicable diseases really are now causes 70% of deaths annually globally. So it's a huge number, and it means that cardiovascular diseases, cancer, diabetes, chronic lung diseases are the main killer now, actually, worldwide. So those are the challenges we are currently facing, and it will go even farther, right? So we really need to be more prepared. I need to be closer. for that. And to me, they are also creating a great opportunity to implement conversational AI to improve patient journey throughout the whole treatment cycle. And speaking about patient journey, if you think about chronic disease, please do not imagine like vacation on a tropical island. It's really long, challenging journey, which is rather similar to the Fellowship of the Ring journey, but with one big challenge, that there is no wizard who can really help the patient. And the journey is really very emotional, so to get from one milestone to the other, it's usually years. It could take years actually for patient. Sometimes the diagnosis is a really relief, so patient is thinking, I don't have a cancer, I might eventually end up in a wheelchair. So I'm not sure if it's that relief, but it's like that currently. And sometimes the diagnosis feels like really sky is falling. So it's really emotional, it's devastating. It has lots of ups and downs. And what is even more important, this journey, it's not only somehow touching only patients, their families, but it's very challenging for whole ecosystem, for doctors, scientists, nurses, and even more actors with these ecosystems. And if you think what actually is happening in this journey, to me, if I could summarize it, very often it's about having right information at right moment. It's about having an emotional support or support at all to have it when it's needed. It's also about taking a good treatment decision based on the holistic information available. So does it sound to you like something where conversational AI can actually make a change? I see you nodding. To me, actually, it does. And it seems this journey already have started. So from really simple automation, we call it simple, but the automation around scheduling appointments, having the prescription refill, answering some FAQs, which is already available, we can go to the companion diagnostic. So you can imagine that, for example, this companion diagnostic can somehow discover the progression of the disease based on the changes of the signals in a patient voice, actually. And this can actually happen during like the regular interaction with the voice bot, for example. So it doesn't have to be diagnostic from the design, but during this regular interaction, it can happen. So we are like from start to the end, but there is still something in between. So to me, before we start running, we need to have this baby step and a little bit crawling. And to me, there is a great potential space currently to use text, voice, and multimodal actually assistant to empower patients in their disease management on daily basis, or maybe I should say when they need it and when it's needed actually. So even adding like the virtual appearance and somehow responding to the patient emotion, the rapport which is been between patient and yet still machine, we can't forget it's about machine, can really strengthen the journey and can really empower more people on their disease management actually. So this is what I am personally very passionate about, and I'm seeing lots of potential. And maybe some example, because we are here also speaking about the use case. So please meet Andrea. Andrea has been recently diagnosed with the multiple sclerosis. And multiple sclerosis is a disease in which immune system eats up the protective cover of a nerve, and actually it disrupts the communication between brain and the rest of the body. So hearing that, you can imagine the symptoms which can occur during the disease are so different from patient to patient. They have also different severity. It might be vision loss, it's very often chronic pain, chronic fatigue, also problems with coordination, losing actually the mobility at certain point of time. So it's really devastating diagnosis. Some patients could live symptom-free all their life, but some patients really have the symptoms very chronic and devastating throughout the whole journey. So as I mentioned, Andrea has been recently diagnosed. She's really overwhelmed. She is scared. She searched for relevant information, and actually she will be doing this throughout all her journey within the disease. You know, going to Dr. Google is really scary, so this is not the good place to go, and I will not mention ChatGPT now, actually, but it's still very difficult to get right information. Furthermore, she is seeing her neurologist every 3 to 6 months for 15 minutes. So there is no chance that she can remember what actually has happened during that time, and furthermore, even if it was connected to the disease, actually. So we can argue if it's actually the role of the healthcare professional, nurse, maybe patient association to help with that, but they are facing also their challenging. The lack of the time, additionally some administrative burdens, really the variety of symptoms that patients are facing really doesn't make their life easier either. So because as I mentioned already, at Roche we are doing now what patient needs next, we thought we might really think how we can help patients to really have better journey and to improve their disease management. And within the team, we really thought that conversational AI, and in this particular case, actually voice, and we end up with the multimodal assistant, can be really a great opportunity to see if it's happening and if the disease management is better. So we were having few hypotheses because we trigger an experiment. So we didn't want to go with like a full-fledged solution. We have an idea, we really go for that, because we still don't know, but at a certain point of time, we didn't know at all if it's actually the right channel for having an interaction and distributing the information through patient. We really wanted to test if voice is the right modality, so if patients really want to interact with voice, and especially if you think about MS, this is also a disease which can impact your mobility, so the texting is not the right modality either. And what's more important, we really wanted to check if patients feel that they know more about disease, that they can ask more relevant questions to the doctors. And last but not least, what I've shown, it's also checking the technical feasibility. Our experiment took place in Belgium, and we had our platform, which unfortunately didn't support the Flemish language, so we have to use Dutch instead of Flemish and French. But because there were lots of other hypotheses we wanted to actually test, we just said, okay, we go with what we have, not to make too much investment and just to leverage what we have. So I believe now I have for you video, which has been done for our patients. Yeah, but
We know from you that it is not easy to find and access various pieces of information in regards to multiple sclerosis. You often lack information and guidance on specific topics you encounter in daily life. You don't always feel comfortable talking to your healthcare provider about some topics. Consultation time flies, and you don't have the time to talk about all topics. It is difficult for you to remember and connect the various symptoms you experienced with multiple sclerosis. We want to change it, and now you have in your hand Emerson, MS Virtual Assistant, which, in the future, can provide you with all the needed information to help you manage your disease. For now, it's only a test version. We are presenting you only the first test version to collect as much feedback as possible to see if it is worth developing further. Your HCP has selected you, and we all are counting on frequent interaction with the assistant and your feedback. Emerson is not designed to process personal data for any other purpose. We strongly encourage you not to include any personal information in your conversations with Emerson. We do not proactively collect personal data, like IP address, location, etc. Emerson is neither intended nor designed to record or report adverse event information. If you have a suspected side effect or problem to report regarding Roche products, please use the web form which you can find in the help section of the app. Emerson language is set up according to your
So it's supposed to stop by itself, but it didn't. But there's more, there are features, but what I wanted to show you, this video was not created in purpose of this conference. We created really to have a better conversation with patients and really encourage them to use Emerson. You see there are also lots of constraints which has been already talked a lot and will be also talked further on the privacy, data privacy stuff, which is super important topic. And very important part, we built Emerson to not bring another hurdle to the patient, so we decided to create hardware and software agnostic web app, so it's really easy to test it. So as I mentioned, Emerson has been tested with patients, so we develop really kind of a fast-paced an application, which has been done really in this iterative spirit. So the features we wanted to introduce as a content has been really validated with and co-created with the ecosystem together. And we actually end up with the user testing, so we have few patients testing the app with us. We did quantitative mainly testing and also a little bit of qualitative. But the feedback was so encouraging. So first of all, we learned that this is really right modality, and at least we can think that we actually should more explore the idea. What was totally surprising to me, majority of patients started interaction with voice. So really voice appeared to be a preferred channel for the interaction. Even though I must admit, and we knew already from the beginning that we, first of all, haven't trained enough the solution, and it was quick experiment, so we didn't even have chance to do that. So of course the bot, so our assistant not always understood patient, but there was a behavior which I would love not to strengthen and have in the future, but when the bot answered not the right questions, patients who were testing it already been on the journey for years and decades, they said, oh, I didn't know that. This is interesting. So to me, as I said, I was like, first of all, we want to encourage this situation, but it already gives me lots of thought how important actually is still to provide information is an easy way, actually. So with that very encouraging feedback, we really decided to explore further, and with my team we are doing this year, so I hope next year I will have more stuff to share, if you will be willing to actually hear more. But even though we are still in the exploration phase, I'm pretty confident that I can share some ideas how actually important could be implementing the conversational AI in a healthcare space area, and mainly in this disease management part for the patient. So no brainer here, the content is a queen, but what it's even important in this particular case, the source of the truth. So this co-creation, working together, gave more trust, actually. And just to be fair, achieving the ultimate goal, which is around better health outcome for patients, is actually of value for each actor of this ecosystem. So really the willingness for the co-creation was there when we were introducing the experiment, and now when we are really continuing, I feel it's even more. So really there are more interest from the ecosystem to really go for it. Last but not least, ethics and trust. And I knew I will have not much time to cover it, and today morning Hilda actually started really great consideration around it. But nothing to add more. This is really heavy regulated environment and potentially very harmful, so we definitely need to have a guidelines. But what is important and what I would love to leave those thoughts for you, there are lots of great value which already AI, not conversational AI, but AI brought to the healthcare space. And we really need to be more vocal to bring more kind of a balance between the harm, and of course this needs to be mitigated, and the risk which needs to be mitigated, but also the value which can bring. And I couldn't say, well, something has happened about the generative AI. I think we will have more and more talks about it, so I will not go in that direction. But what I wanted to say, and I really provide few really good answers from the ChatGPT. So if we are able in the future to make sure that large language model and generative AI can produce predictive answer, I would say there is still a place. But we need to be aware of the risk, and we really need to be sure we not make any harm. And that's actually all what I wanted to present today. Questions?
We have some time for a couple of questions. Anybody?
Thank you. This has been absolutely brilliant, and I hope that we see you next year with some more cases and further exploration of the pilot. I've been wondering, can you tell us a little bit about how many patients you used Emerson with, and have you found any actual use cases that Emerson cannot help with and that human contact is absolutely necessary for?
Oh, it's absolutely. Thank you for that question. So I can't even tell you, because those were the doctors who were really also trying to distribute more Emerson with the patient. But the last testing we did, like with the few, like 5 patients, so that was the user testing. But it was actually tested with the doctors and patients, which a broader reach. And to us, it was not about, the number. It was really about more understanding if there is a space for that. And if you think about use cases for now, Emerson is mainly targeting the silent symptoms area, so really to better understand if the symptoms can be connected to the disease. But I can imagine it go further. If this is like an MS assistant, you can even ask, which we don't have like now in plan, but it can go to the direction, okay, can I find a restaurant which is suitable for wheelchair person, for example? So it could be like of an assistant. But what is even more important, and that is why I wanted to strengthen this collaboration, this is not to replace doctors. And just to make this message clear, that is why we have like a great collaboration, because doctors see a great potential and actually a helping tool to them to really help patients. There are lots of taboo questions around of silent symptom. It's about the sexual life, for example. And believe me or not, patients are really, people with the disease really struggle to ask this question. I might also have problems to ask this question, right? And also doctors are not super trained always to discuss this, right? So this assistant really, I saw lots of interest saying, oh, this question, I never would have ask doctor about it. But of course, it's not to go to the doctor, but it's about also kind of give this feeling to patient that this is the right question to be asked, and that patient should not be afraid of doing it.
And it's a safe space to ask it.
Exactly.
Yeah, brilliant. Thank you very much.
One question I have is, have you seen any use of speech technology for people that have speech challenges? My daughter, for example, she has Down syndrome. And she has a very hard time with voice assistants. And I work in this space, and I know how difficult it is. But I'm curious, particularly in the medical world, has there been much work on that? I know there's been some data gathered, but that's an area that I've been very interested in and seen what you've seen in that space.
Well, so we are not yet there with what we are doing, especially that we started, and we also need to figure it out what is the space for that. But we also know patients with SMA area, so it's really actually the place when even voice-operated home devices are making a big change in their life, actually. So to me, it's the way to go. But I think majority of us knows also that the voice is still generating accessibility issue, actually, because even in our Emerson, we should have Flemish, and we didn't have it because of the platform. So there is a great space in voice, and really to serve patient globally, we need to take more consideration. And I can imagine also from training data perspective, right?
No,
Because even
there's
if
very
you-
limited training sets on that.
Exactly, right? So a huge space there.
I think that's the final question, and then we have to move on.
Thanks so much for that presentation, Paulina. On the note of not having conversational AI replace doctors, but to actually complement the work that they're doing in the future state, how are you envisioning the bot being able to recommend, certain care or medication and actually connecting the dot to help the patient get the care that they need beyond just the information delivered in the assistant?
So I think it will also depend on how the application or the assistant is provided. So what we foreseen for us, the doctors are the one who are recommending this as well. So we are seeing it's like a really tight collaboration here. So I would avoid suggesting or treatment decision or what to do. For example, in Emerson, we have so-called daily tips. But this is like the knowledge which is broadly available, but it's done in a way that it's digestible and that it's better provided, and it also comes from the reliable and trustable source. So to me, it's rather some advices, but really not to go in the direction that someone will actually start to treat themselves without help of a doctor, or really even kind of replace it. It's not the direction. Definitely. Thank you.